Now moving on, private health facilities will now begin administering privately procured Covid-19 jabs to Kenyans free of charge in an effort by the government to increase its vaccination points nationwide and capture more people. The Ministry of Health, through the Kenya Private Sector Alliance, is also set to supply private companies willing to have their staff vaccinated with the jabs at an affordable cost. Purity Museo with that report.
The government's plan to vaccinate 10 million people against Covid-19 by the end of this year and 30 million by 2020 received a major boost as the Kenya Private Sector Alliance KEPSA now commits to partner with the Minister of Health in ensuring more people are inoculated against the deadly Covid-19.
Where there's been increased vaccination, the economies are rebounding much easier, much better, and we're seeing more jobs getting created. We're seeing less deaths, less sick people, and we thought we could play a part as private sector.
KEPSA Chief Executive Officer Carol Kariuki reassuring free vaccination services for all workers in the private sector.
Vaccines are free of charge. Remember, the companies are putting the money together to vaccinate the employees and the employees' families, and some of it going to the communities around.
To scale up the vaccination drive, the Minister of Health has further identified a number of private hospitals in the country that will administer the jab to Kenyans free of charge.
They are actually privileged. We have Nairobi Women's Hospital, but we have Avenue, Metropolitan, Nairobi Women's, MP Shah, Gertrude's, Meridian, and Karen Hospital. Those are the first ones that we are working with right now, and others will join in as we go along.
Chief Administrative Secretary in the Ministry of Health, Dr. Mercy Mwangangi, who spoke during official rollout of private sector's Covid-19 vaccination drive, further said the ministry was considering supplying the Johnson & Johnson jabs to pastoralist counties owing to their migration tendency.
J&J is a special vaccine because we are considering having it allocated to perhaps migrant communities, distant communities where people may have challenges coming for their second dose. And so there's a bit of logistic planning that has to happen in that area. There's a bit of, should I say, rationing of doses that we need to do so that we don't also have issues of expiry.
She expressed concern over low second jab uptake by Kenyans, warning it would predispose them to health complications posed by the pandemic.
Those who have 2 doses are seemingly more protected, particularly when it comes to ICU admissions, the need for oxygen, and severity of disease.
Kenya has already vaccinated close to 3 million people, with AstraZeneca, Johnson & Johnson, and Moderna being the available vaccines. Sinopharm and Pfizer vaccine doses are expected in the country before the end of September. Purity Museo, Prime Edition.